Okay, thank you, Diane. I'm just going to go to the next slide. So as Diane said, I am Monika Dutt, and that intro is probably longer than what I actually have to say today because I am looking forward to hearing our main speakers. Building on what Diane said to introduce her part of the session, I want to say that I am in the district of Timiskaming, which is located on the ancestral territory of the Anishinaabe, and a significant percentage of the population in the district is First Nations, either Algonquin, Ojibwe, or Cree, and also Métis. And also building on Diane, kind of connecting that into other work, I think acknowledging the land is really important to any issue, but I think as we're thinking about climate change and equity, I think it's particularly important given, as we know, some of the disproportionate impacts of climate change on especially many northern Indigenous communities, but also some of the really innovative community-based approaches that are coming from Indigenous communities and Indigenous people. So kind of keeping that in mind as we go through this session. So part of today is just to give you a brief description of what the alPHa-OPHA Health Equity Work Group is. As you can tell, I don't follow directions all that well sometimes, so my slide is my own making of many colors, but I know this is a national audience and maybe even international, and this is an Ontario-based group, but just to tell you a little bit, it's a combination of the Association of Local Public Health Agencies and the Ontario Public Health Association, and the purpose is outlined there. So it's been around for many years and looks at social inequities in health in Ontario in particular, and works on various issues through a range of activities, including advocacy, education, partnerships. We've done a range of different work from looking at how to measure health equity, working with different Indigenous partners, advocating to and working with government on a range of policy issues, and also knowledge translation in a range of different ways, including through events like this webinar. And so the decision to try to organize an event like this started with a discussion in the work group when we were looking at areas we were focusing on and realizing that there hasn't been a significant focus on climate change, and that's a gap that we need to look at when looking at health equity issues. So that led to a search of who could we find that would be able to speak to health equity and climate change, particularly in the local public health context, because there's so much that can be done at the local level. So that also led me to the guide, which you saw on, if you clicked on the links in the announcement for the webinar, to the Climate Change, Health and Equity Guide for Local Health Departments, which our speaker, Dr. Linda Rudolph, will be speaking to shortly. And so we're really excited to be able to have her come in and speak to, we were thinking just a work group and then thought it would be great to have a larger audience. So thank you to the National Collaborating Center for Determinants of Health, who has partnered with us to be able to give us a much bigger platform. And I just put my email address on that slide in case anyone's interested in learning more about the working group. You can send me a note and I can connect you in. You do need to be a member of alPHa or OPHA. So that is my little bit, and now I am really excited to be introducing Linda Rudolph, who is one of the authors of the guide that motivated this webinar. So she is the director of the Center of Climate Change and Health at the Public Health Institute in the U.S. She is based out of Oakland, California. Her bio is linked to in the webinar announcement. I won't go through it all, but if you look at it, she has an incredibly impressive background and has worked at local public health department level as well as state level in California on a range of different initiatives, from health and health policies work to climate action work. She's also worked with international unions. She's also is a board certified occupational medicine physician. So we are really excited to have her with us today, and I'm going to now turn it over to Linda and let her talk about the work that she's been involved with. Thanks, Linda.